What if we told you there was a way to improve patient satisfaction, increase office efficiency, and decrease patient mortality? If there is one thing you can do today, it would be to focus on optimizing continuity of care for your patients. Along with reductions in mortality, evidence shows that by prioritizing continuity, patients have better health outcomes overall, costs of care are lowered, while quality is increased, along with patient and provider satisfaction. Your HQCA panel report has important information to help you examine access and continuity in your practice. This short video will help you focus on the continuity of care for your patients and walk you through a 4-step process towards improvement using access-related measures. Your provider activity can be found on page 8 of your report. This is the total number of visits that you provided to patients at your clinic. This measure is an indicator of the capacity of services you provide to your panel of patients. This will include patients who are yours, as well as those of other primary care providers who came to see you for care. Second, on page 42, you will find the total number of visits your patients to primary care providers completed each year. This includes visits to you and all other family physicians. This could be considered the demand for a primary care physician. In an ideal world, high continuity of care means encouraging all family physicians to find ways to manage the demand of their panel or optimize the supply and capacity of the services they provide. As such, it's important to consider whether your capacity in the previous step can match this demand. So let's see if your capacity can match your panel's demand. Remember that you may not be the only primary care physician that sees your patients. People will go elsewhere for care if they perceive a practice to be inaccessible or unacceptable for their needs. Step 3 walks you through the number of visits your patients had with other family physicians compared to what you were able to provide. Here we see that the panel's demand of 4,267 visits to any primary care physician exceeded the physician capacity of 3,391 by 876 visits. On pages 14 and 15, you can find your average physician and clinical continuity. To dive deeper into how access to you may be affecting your continuity of care, here are some things to think about. Physician continuity is the proportion of total primary visits by your panel, which can be found on page 42, that you had the availability to support. In this instance, the physician was able to see 72.8% of the 4,267 visits demanded by their panel. This means that about 1,160 visits by this physician's panel were to another primary care provider. However, in some instances, continuity to a patient's primary care practice may be appropriate. Therefore, considering continuity to the practice is worth exploring. Here we see that an extra 11%, or 470 of the 4,267 visits, were able to be seen by other physicians in the clinic, leaving 690 visits to other practices. Among those, how would you know why they needed a visit? What were some of the diagnoses or treatment options provided, and would this impact your relationship with that patient? There are a number of ways to reflect and review on this through your PCN or other support programs available to you. The final step in considering access to your services involves looking at the number of emergency department visits that could have been treated or managed by a primary care physician in their office. This information can be found on page 47. In this example, 80% of these visits are occurring during office hours. Why might this be happening? Could access to your services be a reason for this? If the visits are after hours, then there is an opportunity to explore whether there is a demand by your panel for after-hours primary care services coordinated by your clinic or PCN. As you can see, this is a very valuable report, but this is just a quick snapshot. Consider connecting with your colleagues to talk about access and ideas for enhancing continuity for your patients. For tips and tricks to achieve better access, contact your improvement facilitators or PCN partners and check out resources at AIM Alberta. Lastly, check out other parts of your HQCA panel report for more valuable information about your patient panel.